Okay, get ready because we're diving deep into a topic that might surprise you. It's way more common than you might think. OCD. We're talking about something that affects like 1 in 40 people, which makes it even more common than things like schizophrenia and panic disorder put together.
Yeah, and even though it's so common, OCD is often misunderstood and people don't really talk about it. I think that makes it even more important to understand what it really is and how we treat it.
Right, exactly. So for this deep dive, we're going to break down this chapter on OCD from the Handbook of Clinical Psychopharmacology for Therapists. We'll go over all the main points.
The goal is for you to really get the key theories and research, the practical stuff, without getting lost in the technical jargon.
Perfect. Let's start with the basics then. What is OCD? I feel like people throw that term around, but what does it actually mean clinically?
Yeah, I think you're right. It is used pretty casually a lot, but in reality, OCD or obsessive-compulsive disorder is a lot more than just someone who likes things neat or wants everything perfect. We're talking about a serious condition where someone has persistent intrusive thoughts, which are called obsessions, that trigger really intense anxiety.
So it's more than just like a neat freak.
Oh, definitely. People with OCD then engage in these repetitive behaviors or rituals. We call them compulsions. They do these things to try to get rid of that anxiety. But the thing is, these compulsions can take up a lot of their time and energy, and it often gets in the way of them living their daily life.
Can you give us some examples of these obsessions and compulsions? Like, what would that actually look like?
Sure. So the handbook mentions contamination fears, and that's actually one of the most common obsessions. This can lead someone to compulsively wash their hands all the time or avoid touching certain objects or even get into really excessive cleaning rituals. Another common one is safety and harm. So people might constantly check their locks or, appliances or worry about causing harm either to themselves or others.
I can see how even though those things are supposed to reduce anxiety, they actually end up making life a lot more stressful.
Exactly. And that's kind of the paradox of OCD. The compulsions help for a little bit, but over time they actually make the obsessions and anxiety worse.
So how do I know if I'm just a worrier or if I actually have, clinical OCD? We all double check things sometimes.
That's a really good point. It's all about how intense these thoughts and behaviors are, how often they happen, and how long they last. Someone with OCD might spend hours every day completely consumed by their obsessions and compulsions. They feel significant distress and they really struggle to function normally.
Sounds exhausting.
It is, and this is why we have to talk about the emotional burden of OCD. Imagine feeling trapped in a cycle of intrusive thoughts and these rituals that you know aren't rational, but you just can't seem to stop. The shame and humiliation that come along with these experiences can make people feel really isolated.
That would definitely stop people from getting help, I would think.
It's a huge obstacle. A lot of people with OCD suffer in silence for years. They feel like they're the only ones or that what they're experiencing is too weird to share.
I think that shows just how important it is to talk about mental health and reduce the stigma around it.
I totally agree. And it's important to remember that OCD isn't just one thing. The DSM-5, that's the manual that we use to diagnose mental health conditions, it actually lists several different OCD-related disorders.
Really, I always thought OCD was just, OCD. What are some of these other types?
Well, there's body dysmorphic disorder, hoarding disorder, trichotillomania, that's hair-pulling disorder, and excoriation disorder, that's skin-picking disorder. They all have their own diagnoses, but they have that common thread of intrusive thoughts and repetitive behaviors that try to decrease anxiety.
So someone with trichotillomania might, feel this really strong urge to pull out their hair, even if they know it's hurting them.
Exactly. And the important thing is these behaviors aren't about them choosing to do this or being weak-willed. They're actually driven by underlying anxiety and this really desperate attempt to feel relief.
Okay, so there's a range of OCD-related disorders, but how is that different from something like obsessive-compulsive personality disorder? I've always been a little confused by that.
It's subtle, but it's a really important difference. In OCD, the person recognizes that their obsessions and compulsions are too much and they're distressing. They don't want to be doing these things, but they feel like they have to. But with OCPD, people see these traits as just part of who they are, and they might even see them as good things.
So someone with OCPD might be super rigid, perfectionistic, controlling, but they don't necessarily see that as a problem.
Exactly. They might even be proud of how meticulous and organized they are. The difference is, someone with OCD feels like their obsessions and compulsions are intrusive and they don't want them, and it causes them a lot of distress.
So it depends on how the person sees their thoughts and behaviors and how much it's bothering them. What about impulse control disorders? Where do those fit in?
Okay, so both OCD and impulse control disorders, or ICDs, have these repetitive behaviors, but the reason behind them is different. In OCD, compulsions are done to make the anxiety from the obsessions go away. With ICDs, the behaviors are more about pleasure or gratification, even if there are negative consequences down the line.
So someone with an ICD might do things like gamble compulsively or go on shopping sprees looking for that immediate reward, even if it could cause them harm later on.
Exactly. And while there can be some overlap, it's super important to be able to tell the difference between OCD and ICDs. That way, we can figure out the right treatment approach.
I see. Now, the handbook also mentions anorexia nervosa. How is that related to OCD?
Well, there can be some superficial similarities, especially when you look at food-related obsession and rituals. But there are major differences. People with OCD often know that their fears and behaviors not make sense, but people with anorexia might not see their distorted body image or eating patterns as problems.
So it's not just about having rituals, but more about why they're doing those behaviors in the first place.
You got it. And it's worth noting that the medications that work for OCD usually don't work for anorexia nervosa. That just shows how different they are.
This is also interesting. Understanding OCD seems like it involves figuring out all these different disorders and how they're connected.
You're absolutely right. To get an accurate diagnosis, we really have to look closely at the specific symptoms, what motivates those behaviors, and how distressed the person is and how much it's affecting their life. And that's where a trained mental health professional is really important.
Okay, so we've talked about what OCD is and what it isn't. But where does it come from? What causes this complex disorder? Is it nature, nurture? What is it?
Well, older theories used to say it was because of how someone was raised, like if their parents were very strict. But more recent research shows that OCD probably has a biological basis.
Now it's getting interesting. What kind of biological factors are we talking about here?
Well, there are a few things that point to a strong biological link. First, OCD often shows up early in life, like even in childhood, and those symptoms tend to stay pretty consistent throughout a person's life. That kind of suggests a biological predisposition, not just a phase.
So it's not just kids being, kids.
Right. Another thing is, studies have found that if one person in a family has OCD, their kids are up to 4 times more likely to have it too compared to the general population. That's pretty strong evidence that genes are involved.
Yeah, that makes sense. But is there more concrete evidence than family history to support the biological basis of OCD?
Definitely. Brain imaging studies have shown that certain areas of the brain are more active in people with OCD, specifically the basal ganglia, which helps with habit formation, and the prefrontal cortex, which is responsible for decision making. The thinking is that this overactivity in these areas contributes to the repetitive thoughts and behaviors that we see in OCD.
Oh, so there's a clear link between brain activity and OCD symptoms. And is that also why antidepressants, those SSRIs, are often used to treat OCD?
That's a great connection. SSRIs make more serotonin available in the brain. And while they're usually thought of as depression medications, they've been really effective in managing OCD symptoms. And, even in people who aren't depressed.
Wait, so SSRIs can help with OCD even if someone isn't depressed?
Yeah, and that supports the idea that serotonin plays a big role in what's happening with OCD. It suggests that maybe OCD is related to problems with serotonin levels or how it's working in certain brain circuits.
That's fascinating. It shows how connected everything in the brain is and how one neurotransmitter could be involved in all sorts of things.
Exactly. And even more evidence that connects brain activity, serotonin, and OCD is that brain imaging studies have shown that SSRIs actually help to reduce that overactivity in the basal ganglia and the prefrontal cortex.
So medication is one way to go about treating OCD, but what about therapy? Are there any options there?
Yeah, so the most established and effective therapy for OCD is called exposure and response prevention, or ERP. It's a kind of cognitive behavioral therapy, CBT, that's specifically designed to help with the challenges of OCD.
I've heard of ERP before, but I don't really get how it works. Could you explain it a bit more?
Of course. So ERP involves gradually exposing people to the things that make them anxious while at the same time helping them resist the urge to do their compulsions. The idea is that with repeated exposure, they'll see that the thing they're afraid of doesn't actually happen, and their anxiety will slowly decrease.
So it's kind of like facing your fears, but in a safe environment.
Yeah, exactly. For instance, someone with contamination fears might start by touching a doorknob without immediately washing their hands. As they get more comfortable, they might touch something that they think is even more contaminated, like a public toilet seat.
That must take a lot of bravery.
It does. And that's why ERP should always be done with a trained therapist. They can help the person come up with a list of their fears from least scary to most scary and start with the easier ones.
It sounds tough, but if it helps people break free from those obsessions and compulsions, it must be worth it.
Absolutely. Studies have shown that ERP is super effective in treating OCD. Success rates can be as high as 75 to 80%. It's a really powerful tool.
So we've got medication targeting those biological factors and ERP addressing the behavioral side of OCD. What if you combine the two?
Combining ERP and medication is considered the most effective way to treat OCD. Each one tackles the disorder from a different angle, so it's a more comprehensive approach to managing symptoms.
So it's like a double attack on OCD.
Exactly. Medication helps to balance brain chemistry and lessen the intensity of those obsessions and compulsions. And ERP gives people the skills and strategies they need to face their fears and deal with their anxiety in the real world.
This has been really insightful so far. We've covered so much. We talked about what OCD is, what it's not, the different types, the emotional toll it takes, potential causes, and the most effective treatments.
It's been a deep dive for sure into this really misunderstood disorder. And it's important to remember that even though OCD can be very challenging, there are effective treatments out there.
Absolutely. Before we move on to the next part of our deep dive, I want to leave you with something to think about. We talked about how OCD affects the brain, but what about relationships? How might living with OCD affect families, friends, or romantic relationships? That's something to think about as we continue exploring this fascinating disorder. Stay tuned for part 2 of our deep dive on OCD.
So welcome back to our deep dive on OCD. Before we move on, I think it's important to go back to that question, the one we left you with. How does OCD affect relationships?
Right. It's easy to just think about the person who has OCD, but it can really have an impact on the people around them too.
Absolutely. Imagine like you're a family member or a close friend and you're watching someone you care about struggle with these intense fears and compulsions, things that might not even make sense to you. It can be so hard to understand, especially if you've never experienced OCD yourself.
Yeah, it must be really tough to see someone you love going through that. What are some of the things that families have to deal with when someone has OCD?
Well, I think one of the biggest challenges is just not understanding what's going on. Family members might not realize how serious OCD is, or they might think the compulsions are just quirks or bad habits. And that can lead to a lot of frustration and impatience, even arguments within the family.
So education and awareness are really important, not just for the person with OCD, but for everyone around them too.
For sure. When families learn about OCD and they start to understand that it's a real illness, not a choice, it can completely change how they approach the situation.
So what are some practical things that families can do to support their loved one who has OCD?
One of the most important things is to not give in to the compulsions. I know it might seem helpful in the moment to help with a ritual or avoid situations that trigger them, but actually that can just make the OCD worse and make it harder for them to get better in therapy.
So it's about finding that balance, right? Like being supportive, but also encouraging healthy ways of coping.
Exactly. Family therapy can be really helpful here. It gives everyone a safe place to talk about their feelings, learn about OCD, and come up with ways to support each other.
Sounds like good communication and a willingness to learn are really key for families dealing with OCD.
They are, for sure. Now, switching gears a little bit, I want to talk about some important things the handbook says about diagnosis and treatment. First off, OCD is often missed. It's not diagnosed as often as it should be, and it's not treated enough. Studies show that up to 70% of people with OCD don't get a proper diagnosis for years, sometimes even decades.
Wow, that's a lot of people. Why do you think that happens?
Well, we talked about the shame and stigma before, right? A lot of people with OCD feel embarrassed about their symptoms, so they don't want to get help.
It's sad that so many people suffer in silence, especially when there are effective treatments available.
I agree, it is. And on top of the stigma, the fact that OCD can look so different in different people makes it hard to diagnose sometimes. The symptoms can overlap with other disorders too, so even doctors and therapists might have trouble recognizing and correctly diagnosing OCD.
So it's kind of a perfect storm, right? You have the societal stigma, the complexity of the disorder itself, and maybe even some healthcare providers who aren't as familiar with it.
Exactly. That's why it's so important to find a mental health professional who really specializes in OCD and related disorders. They're the ones who have the knowledge and experience to figure out what's going on and recommend the best treatment.
Okay, speaking of treatment, the handbook has a whole table about different medications that are commonly used for OCD. I noticed that the dosages they recommend for OCD are often higher than what's usually used for depression, even though both can be treated with SSRIs. Why is that?
Good catch. So SSRIs work on serotonin in both conditions, but it looks like we usually need higher doses to manage OCD symptoms compared to depression.
So even though it's the same type of medication, maybe the way it works in OCD and depression is different, and that's why the doses are different.
Yeah, that's a good possibility. It shows that even though medications might target the same thing, their effects can be really different depending on what disorder you're treating and the person's individual brain chemistry.
It's pretty amazing, there's still so much we don't know about the brain and how different conditions respond to different treatments.
For sure. And the handbook also says that some people might need even higher doses than what's usually recommended, especially if their body processes the medication quickly or if the standard doses haven't been working. It's really not a one-size-fits-all situation.
So it sounds like finding the right dose takes a lot of close monitoring and adjusting based on how the person responds.
Absolutely. It's really important to have regular checkups with a psychiatrist so they can keep an eye on side effects, adjust the dosage if needed, and make sure the treatment plan is working well for that specific person.
Medication is obviously a big part of OCD treatment, but we also talked about how important therapy is, especially ERP, in helping people learn how to cope and break free from those compulsions.
Right. The handbook really emphasizes that combining medication and ERP is the best approach for the best results. It's kind of like attacking OCD from two sides, both biologically and behaviorally.
I like that analogy.
Right. So the medication helps to regulate the brain chemistry, which can help with the obsessions and compulsions. And then ERP gives people the tools and strategies they need to manage their anxiety and resist those compulsions when they come up in real life. It's all about helping people take control of their OCD instead of letting it control them. And it's important to remember that successful treatment doesn't always mean getting rid of all the symptoms. For many people, it's more about learning to manage the OCD so it doesn't take over their lives or stop them from doing the things they want to do.
That's a great point. It's about finding a way to live a good life, even with OCD.
Exactly. And that often involves a combination of things like medication, therapy, lifestyle changes, and support from loved ones and mental health professionals. It's a journey, and it takes commitment and patience, but it's possible.
This deep dive has been so informative. We've talked about what makes OCD unique, the different types, how it impacts people emotionally, what might cause it, the best ways to treat it, and even the challenges of diagnosis and medication management.
It has been a thorough exploration, and I really hope our listeners now have a better understanding of OCD and the help that's out there for people who are struggling. We've covered a lot, but there's always more to learn about this fascinating and often challenging condition.
Before we get to the last part of our deep dive, I want to leave you with something to think about. We've talked about OCD having a strong biological basis, but what does that mean for things like genetic testing and early intervention? Should we be screening for OCD risk, and if so, when? These are tough questions, but they're definitely worth considering as we learn more about the science and ethics of mental health. Stay tuned for part 3, where we'll finish up our exploration of OCD and how it affects individuals and society as a whole.
Welcome back to our final part of this deep dive on OCD. So last time we were talking about, these ethical questions surrounding genetic testing and early intervention, especially because we know OCD has this strong biological component. There's definitely a lot to think about there. There is. On one hand, if we could identify it early, we could start treatment sooner. That could potentially prevent years of suffering and lead to better outcomes in the long run. But then on the other hand, there's the risk of diagnosing it when it's not really there or starting treatments that aren't needed, especially because we're still learning so much about the genes involved.
And then there are the social implications, too. Like, imagine people being labeled as having a predisposition to OCD just because of their genes. That could really impact things like getting a job, insurance, even relationships.
Absolutely. Those are all really important concerns, and it just shows how carefully we need to approach things as we uncover more about the genetic side of mental health. Any progress we make with genetic testing has to be done ethically, with people's well-being as the top priority.
It just shows that science and ethics have to go together, especially when it comes to something as personal as mental health. Okay, so let's go back to something we discussed earlier. How common OCD is. It's more prevalent than many people think. The handbook mentions that the lifetime prevalence of OCD is 2.5%, which means like 1 in 40 people will have this disorder at some point in their life.
Yeah, those numbers definitely challenge the idea that OCD is rare or unusual. And, it shows just how much we need to raise awareness, reduce the stigma, and make sure people have access to the right treatment.
Exactly. And when we talk about early intervention, the handbook mentions that OCD often starts in adolescence or early adulthood. But what about when it starts in childhood? How often does that happen?
Well, the handbook says about a third of OCD cases actually begin in childhood. And the incidence rate for kids is 1%. That means about 1 out of every 100 kids will develop OCD.
Wow, that's a lot of children. What should parents and caregivers be looking out for? I mean, kids could be kind of quirky, right?
Oh, definitely. Kids go through phases, they have little rituals, but it's important to pay attention if any behaviors seem really excessive or if they're causing the child a lot of distress or getting in the way of their everyday life. Like, for example, if a child is spending hours washing their hands or checking things over and over again or doing these elaborate rituals, it might be a sign of something more.
So what should parents do if they think their child might have OCD?
The first thing is to talk to their pediatrician or a mental health professional. Early diagnosis and treatment are so important. They can help kids manage their OCD and prevent it from getting worse as they get older.
It's a good reminder that mental health is just as important as physical health, and getting help early can make a huge difference.
Absolutely. Okay, so I want to switch gears for a second and talk about this interesting idea from the handbook that some OCD behaviors might actually be based on our evolutionary instincts.
Oh, that sounds interesting. Tell me more about that.
Sure. So the handbook suggests that some of those OCD rituals, like putting things in order, straightening, cleaning, checking, they might be exaggerated versions of instinctual behaviors that we see in other animals. Like think about birds building their nests so carefully, or cats spending forever grooming themselves, or dogs marking their territory.
So it's like those instincts that are programmed in our brains, but in OCD, they get stuck on overdrive.
Yeah, that's a great way to put it. The handbook says that in OCD, the brain's usual way of controlling these urges, of keeping them in check, might not be working right. And that leads to those constant intrusive thoughts and that really strong urge to do the compulsions.
It's a really interesting perspective. It kind of makes you think that these behaviors, even though they seem irrational, might actually be connected to something deeper in our evolution.
Right, and it shows that OCD is even more complex than we might think. It's a really tough disorder to deal with, but the behaviors themselves aren't necessarily abnormal when you think about animal behavior as a whole.
It makes you wonder why we have anxiety and fear in the first place. I mean, maybe those feelings, in the right amount, help us stay safe and avoid danger.
It's possible maybe in OCD, those fear responses get way too strong or they're directed at the wrong things. That's what leads to the really tough symptoms. Like the volume on those instincts is turned up too high.
This deep dive has given us so much to consider. We've talked about how widespread OCD is, the many forms it can take, what might cause it, the best ways to treat it, and even the idea that it might be linked to evolution. It's clear that OCD is a complicated disorder, and treating it requires a really comprehensive approach.
For sure. And I think the main takeaway is that OCD is treatable. If you or someone you know is struggling with it, there is hope. It's important to reach out to a mental health professional, learn more about the disorder, and not be afraid to ask for help. With the right support and treatment, people with OCD can live full and meaningful lives.
I completely agree. Remember, the more we know about OCD, the better we can support those who are affected by it and advocate for better treatments and resources.
You said it. It's through open conversations like this, continued research, and really working to reduce the stigma that we can make a difference for people with OCD and their families.
Well, that wraps up our deep dive into the world of OCD. Thanks for joining us. We hope this has been helpful and informative. Until next time, keep learning, keep those minds open, and we'll catch you on our next deep dive.